other concerns that people have, right? People have all kinds of concerns about the safety of vaccines and potential side effects. Parents are very frightened of doing something to their child that might have long-term ramifications. They don't want to hurt their children, right? Very important and understandable. Vaccines can have side effects, but the vast majority are mild, very short-term, such as injection site pain, fatigue, headaches, myalgia, muscle aches, and chills. These side effects indicate that your immune system is doing what? It's responding to the vaccine. Now, reports of serious side effects are very rare. Hey everyone, Dr. Partha Nandi here. Thanks for joining me today. And beautiful Tuesday where we are. Hope you're having a great day. And today, listen, it's that time of year, back to school. And so thank you for joining me. We're talking about, hey, how do we protect our kids from monkeypox, right? We're talking about monkeypox now. No shortage of viruses apparently. And COVID. It's like when you turn around, there's another virus that we have to worry about. So we're talking about that, and we'll talk about what we can do to protect ourselves. A lot of misconceptions about these diseases, so we'll try to clear that up as much as possible. And let us know, let you know how you protect your kids. So very important to know. Again, I'm Dr. Partha Nandi for those of you who's joining us, talking about back to school and how can we protect both our kids from both monkeypox and COVID. So listen, back to school means what? Bus rides, busy classrooms, and after school activities. People are going to be close to each other. And so, you know, lots of time for kids spending more time with each other indoors. And so I'll talk about monkeypox, right? Monkeypox has really prompted a public health emergency in the United States, affecting over 18,000 people so far globally, over 48,000 cases. So, significant number. And the virus can really affect anyone, including kids. We're talking about monkeypox. A few cases in the U.S. have occurred in children, 17 so far. And public health experts currently feel that most kids are not at a substantial risk for getting the disease. Having said that, super important for parents to understand this virus and be aware, in case symptoms, beware of symptoms in case a situation happens that your kids get infected or the situation changes. So first of all, what is monkeypox, right? Monkeypox, very contagious disease. It's caused by a type of virus called the orthopox virus, fancy name, a viral relative of smallpox. The virus mainly spreads through close and intimate contact, such as hugging, kissing, sexual encounters with people with monkeypox infection who have open sores. And it can also be through contact with items handled by people with the monkeypox infection, like clothing and towels and toys. The virus, it spreads in this way. It spreads when a person has symptoms, and a person can remain contagious until the scabs have really fallen off. Disease typically is mild, temporary symptoms, which could include a rash, lesions, body aches, flu-like symptoms that happen within 3 weeks of exposure, making it really hard to identify early, because if you don't have any symptoms, then you may not even know you have an infection and you can spread it easier. However, also can be very painful and disfiguring. It's important to know that. Young kids under the age of 8 have an increased risk of severe disease if they get monkeypox. And CDC is saying that this virus can result in rare complications, including encephalitis, which is inflammation of the brain, cellulitis, a potentially serious bacterial infection, pneumonia, sepsis, which is fulminant infection everywhere, abscess or pus collection, airway blockage due to big lymph nodes, and something called keratitis, which is inflammation of the eye. And then you can also have corneal scarring, which is scarring from the outermost layer of the eye. So what's the good news, right? Monkeypox is rarely fatal. So far, the cases in the United States, KCUS, have been mild, and it can be eliminated with households disinfected. Monkeypox doesn't have a great capacity to spread in classrooms because it's not an airborne virus. So important to know that. However, Scientists are still trying to determine the extent to which monkeypox can be spread through airborne respiratory secretions, which we breathe out, right? So important. Like, for example, from a sneeze or through urine and feces or a bathroom surface. There are approved vaccines, and I'll really talk about that in a minute. If an infection occurs, a treatment called tecovirimat, also called TPOXX, is available for folks who are deemed high risk, immunocompromised, so their immune systems are not as strong, or if they have complications or severe disease, or are at high risk for severe disease. So most people with monkeypox recover in 2 to 4 weeks, even without medicine that kills the virus causing the monkeypox. What are some signs of monkeypox? Anytime there's a new illness or disease going around, parents should always know what to look for. It's going to be tricky because a lot of viruses can present with similar symptoms. Rash is the most common symptom that we know about with monkeypox. A rash can progress to look like little pimples or blisters, and it can be painful and itchy. It can look similar to other common rashes seen in kids, such as those caused by what we call hand, foot, and mouth disease, chickenpox, and allergic skin reactions. So it can be very, very confusing. If children have any kind of raised marks or vesicles that are fluid filled on their bodies, and parents are not sure where they're from, very important, they need to be identified before attending school. When in doubt, here's what: it's never a bad idea to contact your child's healthcare provider, doctor, to find out, right? And if rashes and lesions are dry and not weeping, so that kids can go back to school. Other symptoms include fevers, they include chills, fatigue, headache. Now, what about vaccines, right? Should children get the vaccine for monkeypox? Currently, public health leaders are saying, listen, they're favoring the 2-dose vaccine. It's called the Jynneos, Jynneos vaccine for monkeypox. The vaccine has been authorized for emergency use here in the United States. However, there is no formal recommendation from the CDC thus far, right? So even though public health leaders, there's no official recommendation from the CDC. The CDC actually recommends vaccination for people who have been or more likely to be exposed to the monkeypox. Vaccines can really prevent someone who has been exposed from getting ill and prevent further spread in the community. Very important. And for kids, the decision will be made, really on a case-by-case basis. It depends on the child is considered to be high risk, of a high-risk situation. If they're in a high-risk situation, the following are important to know. If they're younger than 8 years of age, if they have an immune problem, immunocompromised, do they have conditions where the skin is open, such as eczema or recent burns? Have they been around people who have monkeypox? All this is important to consider. Now, what can parents do to prevent their kids from getting infected at daycare or school? Practicing good hygiene, really good place to start. Have your child wash their hands frequently, especially before lunch or eating snacks. Hand hygiene, super important, not just for monkeypox, but for any infectious disease. Make sure your child's immunization totally up to date. Staying up to date on routine vaccinations, really crucial to prevent illnesses from many different situations and infections, according to the CDC. Now, each state has a list of required immunization for your students to attend school, right? So remember to look out for that. Now, watch for symptoms that signal that your child should stay at home from school. In general, any sickness that a student could spread to others, whether it's respiratory or GI tract, or that would keep them from having a productive day in school, is a good kind of a measure for keeping them at home. Students should stay home if they're experiencing any of the following. Very important to note this: fever of 100.4 or above, cold symptoms like a productive cough or green or yellow nasal discharge, vomiting or diarrhea episodes. Should remain at home for 24 hours or longer, untreated draining ears or significant earache, red, swollen, or crusting or draining eyes, a significant sore throat, and having a communicable disease like chickenpox, pertussis, or COVID-19. So really important. So talk about monkeypox. What about COVID, right? Now, a lot of people think COVID has gone away. Not true. Many people are just, I think, just sick and tired of the pandemic precautions, right? And they don't want to wear masks. But I'll tell you, it's very important because you want to make sure that your family stays up to date in the vaccines. And secondly, stay home from work or school when you or your children are feeling sick. That's critical to keep these infections under check. COVID-19 vaccines, best way, in my opinion, to protect your children from getting long-lasting symptoms or serious illness from COVID. Unfortunately, many kids haven't completed even their first series, right? First series of COVID-19 vaccine, which I think is a shame. Some of this is due to vaccine hesitancy, misinformation, or really other barriers. But sadly, today parents are inundated with social media and messages on the internet that promoting misinformation or mistrust in vaccines. It's just not true. We got to be able to, get this done and get going on this. So, very, very important. So, what are the concerns, right? When it comes to really foregoing COVID-19 vaccinations, the primary reason is it's too new or it's experimental. People talk about that, right? Experimental stuff. So, but here's what parents need to know: the technology for the COVID vaccines that's being used in the pediatric vaccine is a method that's been around for over a decade, not new. Also, China isolated and shared genetic information about COVID-19 so that scientists could start working on vaccines immediately. Now, scientists and vaccine developers have not skipped any steps. Super important to know that. And global collaboration and information sharing has led to more efficient and kind of an efficient process and really better availability of the data. Regarding trials, there are many enthusiastic study volunteers who expedited the recruitment process. Other concerns that people have, right? People have all kinds of concerns about the safety of vaccines and potential side effects. Parents are very frightened of doing something to their child that might have long-term ramifications. They don't want to hurt their children, right? Very important and understandable. Vaccines can have side effects, but the vast majority are mild, very short term, such as injection site pain, fatigue, headaches, myalgia, muscle aches, and chills. These side effects indicate that your immune system is doing what? It's responding to the vaccine. Now, reports of serious side effects are very rare. Now, what about this myocarditis? A lot of my patients ask about this. The reports for myocarditis after COVID-19 is rare. A report really published by the CDC found that 12 to 17-year-old boys had a 2 to 6 times the risk of heart complications, including myocarditis, after COVID-19 infection compared with vaccinations. I'll say it again, they had 2 to 6 times the risk of heart complications with an infection compared to vaccination. And the Advisory Committee for Immunization, as of January 2022, over 8.5 million doses of COVID vaccine were administered to the 5 to 11 age group, right, with 16 myocarditis reports thus far. So 8.5 million doses, 16 myocarditis reports. So not very big number. Over 18.5 million doses of COVID-19 vaccine were administered in the 12 to 15 age group, with 317 myocarditis reports. Again, 265 of them actually make the case definitions of the vaccine safe. For kids, it's safe and well tolerated. What about infertility? People talk about, hey, I'm going to get infertile if I'm taking the vaccine. Infertility, point blank, COVID-19 vaccine does not affect fertility. There's no biological reason that connects the vaccine development to puberty or fertility. The vaccine does not work that way in the body. The myth really rose from a false report, social media, that incorrectly linked the spike protein of the coronavirus to the spike protein called syncytin-1 that's involved in the growth and attachment of the placenta during pregnancy. Very different. The false report said that getting the COVID-19 vaccine would cause a woman's body to fight this different spike protein and affect her fertility, but the two spike proteins are completely different and distinct. In a study posted to RxIV, it has not been peer-reviewed. Scientists found that antibodies against the syncytin-1 spike protein do not increase in the months following a COVID-19 vaccination. further indicating that a syncytin 1 based mechanism of fertility really not supported by scientific observation. And also, a January study just recently in the American Journal of Epidemiology looked at 2,000 couples trying to conceive without fertility treatment. Findings showed this, that no differences between in the likelihood of conception and unvaccinated and vaccinated patients. So you're talking about there's really no difference in the likelihood of having a child between vaccinated and unvaccinated couples. It also shows it also shows that the COVID infection amongst male partners was associated with a short-term decline in fertility that may be avoided by vaccination. Super important to know that. Results from recent research studies show that people who menstruate may observe small temporary changes in menstruation after COVID-19 vaccine, including you may have longer lasting menstrual cycles, shorter intervals between periods, heavier bleeding than usual. And despite these temporary changes in menstruation, no evidence that COVID-19 vaccines cause fertility problems. So, do kids really need to be vaccinated against COVID-19? My opinion, yes, my kids are. The vaccine helps prevent children from getting COVID-19. Although COVID-19 in kids is sometimes milder than adults, some kids infected with the coronavirus can get severe lung infection, become very, very sick, and require hospitalization. This is especially important to remember in light of the variants that are there, which can be very contagious. The current vaccines very effective in preventing severe illness from current variants of the virus. Children also can have complications such as something called multi-system inflammatory syndrome, and they can require intensive care or long-lasting symptoms that affect their well-being and their health. The virus can cause death in kids, right? Although it's rarer than adults. Now, the vaccine, what does it do? It helps prevent, right? It helps prevent or reduce the spread of COVID-19. Like adults, kids can also transmit the coronavirus to others if they're infected, even when they have no symptoms. Now, getting the COVID-19 vaccine can protect rather the children and protect others around them, including family and friends, classmates. Getting vaccinated can help stop other variants also from emerging, right? Cases of COVID-19 are increased amongst children, and variants appear to be playing a role. So, super important. Reducing viral transmission by getting vaccinated also reduces what the virus's chance to mutate into new variants that may be even more dangerous. However, the virus can transmit easily between unvaccinated children and adults, giving new variants a chance to emerge. So, all these things can be helped. Now, having your child vaccinated, mine have been vaccinated for COVID, can help restore a more normal life. Getting vaccinated will help keep children in school and participating in the things they enjoy. Children exposed to coronavirus, also who are vaccinated, are less likely to get infected, so are more likely to be able to continue participating with less disruptions. And I think also COVID-19 vaccines help protect the community. Another reason to strongly consider it for your child is to protect the health of those living and working in your area, right? Each child or adult infected with the coronavirus can transmit the virus to others in the community. And if this happens to some of the people's, who are infected, that can become quite sick themselves or further spread the virus to others who become very sick and even may die, all because of, to me, a preventable infection. This transmission also helps to provide a chance for the virus to mutate further and create a new variant that might provide to be more infectious or resistant to the available vaccines. So all those things, make me favor having vaccines and to be able to protect folks. So I think that, listen, fewer overall infections amongst the population mean what? Less chance of severe infection and death. Super important. What about masks? I think please be respectful of people who are choosing to continue to wear a mask. Wearing a high quality mask to me is super important because it's an important tool to help to limit the spread of COVID-19. People who are immunocompromised, unvaccinated, or feel sick should wear masks to protect themselves and others when in indoor public spaces like school. Babies and toddlers under age 2 should never wear masks because it's difficult for them to keep it on. If you develop symptoms, Really important for parents to be on the lookout for signs and symptoms of COVID-19, which include cough, fever, runny nose, sore throat, muscle aches, headache, and fatigue. The CDC still recommends testing anyone with symptoms of COVID-19 as soon as possible after symptoms start. And parents and children who test positive for COVID-19 are required to stay at home and isolate for at least 5 days. You need to stay home for those 5 days, even if you test again and get a negative test. You may return to work or school if you're negative on day 5. Test is positive, continue to isolate for 5 more days. So really important. I think in summary, here's what we're trying to do, right, is to really protect our kids against COVID-19. Best way, in my opinion, is to really get them vaccinated. And for monkeypox kind of sounds scary, but it's much more difficult to transmit or acquire than COVID. Monkeypox has mainly spread amongst men who have had sex with men, and the risk of monkeypox in kids and adolescents are low. There isn't a huge concern right now amongst kids and adolescents with monkeypox, but parents should still be informed in case there is an outbreak or things change. So thank you. Hey, thanks for watching again. Let me answer some questions. Nina Justas. Don't know where you're from, Nina, but wonder how much money she's wondering. I'm getting, children don't suffer from COVID, almost zero chance, 99.9% survival. And Nina, tell me how many kids you've taken care of, how many patients you've taken care of to say those kinds of things. You should talk to parents who've had kids that have been infected and suffer. How do they sleep at night pushing this experimental drug? Parents wait 5 to 7 years before giving them the shot. If this was 2020, maybe you have a reason to say this, but I'll tell you that after 2 years, it's time to stop all the rhetoric and really talk about the facts. So very important. I think it's irresponsible to make comments like that, and you risk people's lives. So very, very important that. And Christina Swallinger says, my daughter's preschool is saying that if they get COVID, they need to be out for 5 days and then they can return without a mask. I think, Christina, it's a good question. I think they can return to work after 5 days, but I would go back. I would go back to school with a mask. That's what I think is an important concept. Well, thank you all for watching. I appreciate it. Hope your kids and anybody, if you have kids or nephews or nieces, anybody that's young that's going back to school, keep them protected and healthy. I'm excited for my kids to go back to school, and they're looking forward to seeing their friends. So appreciate it. Remember, if you think this is important, share this with your community. Again, make healthy living a part of every day. Thanks for watching. Take care. Bye now. Hi, everyone. I'm Dr. Partha Nandi. And if you enjoyed that video, you're going to love the next one. It's full of incredible information to help you start your health hero journey.